With special populations, looking at training a client with high blood pressure, the way that I would go about the session is I would just make sure that I would give them a decent warm-up. So it should be at least 10 minutes of good warm-up, something on the bike or cycle, getting them to cycle. What I would also make them do is make sure that if they were doing weights, it'd be higher reps and lighter weights, and either in a seated or standing position. So instead of doing the dumbbell chest press, I probably have them doing something like a flies for their chest. And also just making sure that they're breathing all throughout their exercises. Obviously, if they feel any pain, dizziness, anything like that, they should I would ask them to let me know, and then they can stop with the exercises. Training a client with lower back pain, obviously I just want to make sure that their lower back is supported constantly. So in the warm-up, I'd probably expect them to do a warm-up on the recumbent bike because it's a good support for their back. When they're doing weights as well, sometimes it'd probably be best to have them in a seated position, and just to make sure that their back is constantly supported. With a client with a knee injury, because we don't have any further information about what type of injury it would be, obviously the main thing would be to chat to the client and make sure that any exercises they were doing to stop if they felt any pain or discomfort throughout their exercises. Obviously just making sure that their knees aren't locked in a locked position anytime they're doing that sort of exercise. Sometimes if you're not really quite sure about the exercise, it's probably best to just not do any leg exercises at all until they go see a professional to